and welcome to today's episode of Life by Life West. I'm your host, Dr. Mary Oberstein, and today we have an incredible guest with us. Her name is Dr. Miaken Zeigler.
Thank you.
And we're going to have some fun with her today. To be honest, I don't know Dr. Miaken very well. I know her family pretty well. So I'm excited, Dr. Miaken, to hear from you, and I know you have a lot of great information to give our viewers. Just a little bit of background about Dr. Miaken. She went to undergrad at South Dakota School of Mines and Technology, and it's Mines, M-I-N-E-S, not yes, Mines, with a degree in engineering. Graduated from Northwestern Chiropractic College in 2011. She's owned her own practice in Denver, Colorado for the past 7 years. She's married, has an almost 3-month-old little girl named Margot, and just went back into practice this last week, 2 weeks ago?
Last week.
Last week, after being on maternity leave. So I definitely want to get into that a little bit and talk about that. I know we get asked that question a lot. How do I do this?
Yes.
Before we get into that, tell me how you got into chiropractic.
Well, I consider myself blessed because I was born into chiropractic. My dad is a chiropractor, and he actually forced me. I feel like he forced me to work in his practice. He said, Monday morning, start of summer break, when I was a freshman in high school, he said, "You're coming to work today. Be there at 8:30.
Wow.
So I had no choice.
Wow.
And I worked there for 5 summers, and I said, I'm never doing this. And here I am doing this. I went to engineering school and worked in engineering for about 2.5 years in Kansas City, and did it because I wanted to make a difference. And I knew right away that it wasn't something that I loved, and started thinking maybe something in the medical field would be, a better option. Around that time, my dad was visiting Kansas City, and he said, I'm having dinner with all of these presidents of these chiropractic colleges. Would you be my guest? And the Dr. Cleveland stood up and shared his story, which was amazing. And he asked everyone in the room to answer the question, why do you do what you do? And I sat there in the audience hearing these chiropractors who were in practice for 30, 40 plus years, like with this passion and excitement for what they did. And I said, well, I'm only 2.5 years in. I need to get out. I need to go to chiropractic school. So
wow, I never heard that story.
Yeah. And
your dad was president of Northwestern at the time.
Yes.
And now your dad, for our audience, Dr. Mark Ziegler, is the VP of Institutional Advancement at Life West, and does a phenomenal job. So, wow, that's great. Yeah. What a great story. It's not what I thought it was going to be. And I'm sure people think like you're a chiropractor because, so to speak, of your dad, which had he not taken you as his date, who knows where you would have been, right? So
who knows? It was divine intervention.
Well, and I kind of heard that a lot of chiropractic kids, sometimes, growing up, sometimes they see their parents working hard and say, yeah, I don't want to be a chiropractor. And sometimes they dig their heels in and say, I definitely don't want to be a chiropractor. Sometimes they make a full circle and come back and go like, that's what I'm meant to do.
Yeah.
So that's great. So tell me the process from, not so much when you found out you're pregnant, but like the maternity process of how you did that, who took over, how you kind of transitioned the practice, and then how you went back. Here's the dog.
I probably had, probably 3 months before Margot was due, I probably started getting serious about, okay, what am I going to do? So there were really a couple things. First, it was, who am I going to have cover the practice? How long do I want to be out? And how can I create some level of a continuity so that my patients are still hearing and seeing me throughout time, me being completely unplugged from my practice. And so I do weekly workshops. That's required in a policy to be under care. You have to attend those workshops. And so I planned out my workshop schedule from start of, maternity leave through end of maternity leave. And I recorded all of my spinal workshops so that, patients were still getting those recordings every Tuesday nights. I wrote out all of my birthday cards because we send out birthday cards to every patient every month. So I got all of those out.
Wow.
I send out monthly newsletters. So, they get monthly newsletters from me.
Right. Yep.
We're fairly active on social media, but it was all the things that I could think of to provide some level of continuity. So they were still hearing from me while I was out.
That's really smart.
And I think it was really important to have a solid CA at the helm to anchor the practice. I actually brought back a CA who has been with me it'll be 7 years in April. And I said, Amanda, will you help me with maternity leave and just anchor the practice in so that you can take me through? Because I think that's important. Starting off the practice with a new CA would have been really challenging for patients and really challenging for that CA.
Right.
And the other thing was I found 2 great docs who shared my philosophy and practice, who I felt would talk chiropractic and be able to provide a level of continuation of care if it's a new patient coming in. I mean, I outlined, these are my care plans. This is what I recommend. This is who I would put in each care plan. I do want you ordering x-rays. I mean, I wanted it to be pretty structured. So they had directions as far as, okay, this is a patient that falls here. And
Right.
These are the highlight pieces that I want them to hear as a new patient, day 1, new patient, day 2 report.
Wait, can I ask you a question? Where did you find those chiropractors?
So I searched, I think Facebook is a wonderful tool for connecting in chiropractic groups. So in one way I found him through Facebook. I just said, I'm looking for practice coverage, docs who do practice coverage. Mm-hmm. And then I also reached out to my association, so the Colorado Chiropractic Association, said, do you have a list of relief docs? And I had a list of questions to ask folks. So I interviewed probably 6 or 7 on the phone. Mm-hmm. And I will tell you that, I could have spent a lot less money on chiropractors who do relief work. That is their job. Yep. I could have spent probably $150 to $200 less a day to have coverage. And to me, it was worth paying the right person in my practice to be there to deliver the chiropractic conversation and know that they were getting, that philosophy piece and kind of the vitalistic approach, mm-hmm. As a way of introduction into the practice. It was worth it paying that money up front so that when I come back into the office, I'm not having to, call back anybody that we lost.
And say, yeah. And that speaks to you as a chiropractor who cares and loves for her people. Mm-hmm. I mean, it's like you wanted to give them the best instead of just relief docs are great. There's great relief docs out there. But it sounds like you just were really focused on not only keeping that continuation up for them, but just like giving them the care that they'd come to expect at your office, which is really.
And this is important. I think interviewing your docs are important because, one chiropractor, I think she's a great relief doc, but I said, I recommend long-term care plans. Most of them are probably 9-12 months minimum. That's probably the most common care plan. And I shared that with her and I asked, do you feel comfortable recommending those lengths of care? Mm-hmm. And her response was, I'm not comfortable scaring patients. And so you get an idea of where her headspace is around, a long-term care plan and what her certainty would be to recommend somebody come in.
And a no judgment, but it's just not the right person, not the right fit. Yeah.
Not the right fit. So you've got to do your homework on who's going to cover your practice. And that's one thing, coming back into the office, it's hard. There have been many mornings where I am crying on the road, leaving my daughter.
Yes.
And then you come back and as soon as the first patient walks in, you say, it's good to be home. I'm with my people. And, I just feel so uplifted to, be back to where I am. and they said, we loved your docs. I had 2 docs who covered.
Yeah.
We loved them. And so they had, I mean, I gave everyone's information so they could communicate on the days that they, the off days, right? We loved the docs, but we're happy you're back, you know? So it's nothing like coming back into practice where you've really built a community of people who want to be there, who have really invested in chiropractic as a way of life.
Yeah. And not every mom feels that way. There's a lot of different ideas and different ways people go about it. When I was having kids, I talked to a lot of women chiropractors, and there wasn't the resources there are today. I had women saying to me, don't take too much time off or you'll never go back. I had women literally saying like, all these women over here, women chiropractors had kids and they never went back. And that stuck in my head. And when I had my first daughter, Lauren, and my husband was great. Ron was great. It was like, whenever you want to come back, and that always stuck in my head though. It's like, I looked at these babies and then of course having 1 and then 2 and saying like, there's no more important job than this is being a mom. Right. Mm-hmm. It always kind of stuck in my head. The longer I stay out, the harder it will be to get back. And I don't know if that's actually true. I didn't wait to find out. Yeah. I just said to Ron, when they were, I don't remember, a couple months old, hey, I want to start going back in on Wednesday mornings. And I remembered working like 3 hours and it felt like I was a full-time chiropractor again in a weird way. Cause it's like, it was hard to be away from my kids. Mm-hmm. And once I was in there, it was fine. Like I was like, what kids? I don't think I even have any kids because I knew they were taken care of. But I look back now and I'm so glad I did it that way, where I just kind of went back in and had the fulfillment. And of course, part of you taking care of yourself is getting that fulfillment and knowing that this is what I was meant to be doing. Yeah. So
I went back probably, she was 7 weeks old. I needed to go back for 3 days before Christmas. And I felt those were hard. Coming back in January full time, she was just coming up on 11 weeks. I would have been off for maybe 12 weeks. Mm-hmm. I was like, okay, that was a good amount of time for me,
Yes. Yeah. And it's all personal. There's no cookie cutter, right?
Totally.
I mean, I'd give that advice. I'm sure you share the same thing. It's like, you can hear everyone's stories and it's great to do that just to get ideas of, well, somebody did it this way. Someone did it that way. Right. Yeah. But the truth is you just have to listen and, you just got to listen and say like, am I ready? Am I not ready? Mm-hmm. Sometimes you got to go when you're not ready to try it out and say like, nope, too soon.
Right.
Or I should have gone back, a month ago. Mm-hmm. So
I think it's having the support system because I don't know, you find your tribe wherever you are. And there's a great group of chiropractors here in Denver. And, I had a mom specifically say, I know this is a hard morning for you. My first day back. I know this is a hard morning for you. And you will be so uplifted by your patients. And when you come home, you will be so grateful to have that time together with your daughter and husband that if you were there the entire day, you wouldn't necessarily experience. And so, I've been grateful to have chiropractors just uplifting me and, has also been easy to get back into practice because, some people question, well, what are you doing about childcare? My husband works full time, but he's working from home. And we actually are nanny sharing with another chiropractor, which has been amazing,
Oh, that's great.
So I'm like, I don't know if that would have been available to me a year ago if we would have had her, but the timing is right for us to have that,
Yep. Well, I'm going to change gears a little bit just because we're talking about your practice. Mm-hmm. What's you have a successful practice. I know that. Mm-hmm. What's at the core? What do you think what's at the core of you that made your practice so successful? Or how do you show up in your practice that?
Yeah, I think for me, this is constantly changing. It's understanding what's driving me. And I think right now, after having Margot, I love to be connected in a very intentional and just authentic way to people. Mm-hmm. I love one-on-one connection and I love just how it makes me feel in that experience. Mm-hmm. And so I think, especially with having a young daughter and wanting to provide, but wanting her to be connected, from here, here to here and here. I think it transcends that connection, a physical connection, above, down, inside out connection, connection to your world, your higher power. I mean, all of those things. I just love that. And I think there's so many disconnected people in my community. And I think keeping that in mind, that's what drives me to be in practice and see one person at a time. How can I just shift their paradigm a little bit, plug them in, and then slowly over time, help support a better connection.
Well, and that seems to be a theme for even doing these Life by Life West episodes. That seems to be a theme that people talk about of wanting to connect people, wanting to make a difference in people's lives so they can live their best life. And what you kind of just spoke to was, and it starts with yourself, aligning yourself and taking care of yourself. True?
Totally.
Yeah. And that's kind of what I just heard you say too. It's like, you're getting filled up by doing the work you were meant to do.
Oh yeah.
Yeah. And that leads to that like solid foundation, which I know you have. And also being a chiro kid. I know you're not a kid, but being raised in a chiropractic family. I know you and I spoke about this briefly before this call, and I feel you have a really great perception about that, because what I've heard, having 3 daughters who are chiropractors, I've kind of heard this, and they've told me this too. Like, people think, oh, you're raised in a chiropractic family. Well, you didn't have to learn the philosophy in school. You've already had that. And they almost seem to think it must be so much easier for you being raised in a chiropractic family, because again, you didn't have to learn anything. It's kind of like inbred. A lot of the stuff comes natural. The body, that power that made the body heals the body. There's all the stuff that you have, but you have an interesting perspective of that, of how there's a little bit of a downside to that. Can you speak to that? Because I love that.
Yeah. I think this has been probably my biggest challenge in practice, is because I grew up in a chiropractic family. My dad wasn't coming home and spouting, BJ Palmer quotes, I don't remember
books at you at night.
No, we were not getting those. Those are not our bedtime stories, Okay. I didn't hear, and I wasn't educated on the philosophy, but I was innately just lived it, meaning, I got adjusted. That's what I knew. I can remember 10 minutes before a 200-meter dash, my dad adjusted me on the field. It wasn't weird, getting adjusted because I was sick, just laying on the table. I lived it, but I had no idea how blessed I was to have that. And so I find that in practice, because it's so normal for me, I tend to dilute down the chiropractic piece and the adjustment piece. Yeah. And so that's been really challenging for me to, I know it's a miracle. I've had miracles happen in my life personally. I've seen it in practice, and yet it's normal. Right. And it's not normal, it's not normal for most people. And so that's probably been the most challenging thing, is not making it normal in practice, and diluting it down.
Yeah. And I think it's a fine line. There's a really fine line there, because it's like, there's a few layers to it. I remember going in a hospital once and adjusting a baby that was just born, and they were about to take the baby to the ICU. It was like I walked in, they let me go in, and the numbers were all off. The oxygen was low, and they were like, okay, there was a certain team that was coming up to take the baby. The baby's mom had just had an emergency C-section. The baby's dad was standing there, and he was a patient of mine at the time. And I said, can I check the baby? He was like, absolutely. I think the baby was under a hood. We lifted the hood, I adjusted the baby, and all the lights started flickering. Some buzzers went off. We kind of looked at each other, and he was joking. He was like, well, what did you do? And by the time the team got up, and the team was running up there, the team got up and they said, why did you call us? The saturation is up at 98. This baby doesn't seem like it needs any help. And the father looked at me later and said, so the baby never went to the ICU. And the father looked at me and was like, like, are you surprised by that? And I was like, no, not at all. And it was almost like I felt bad years later when I felt like, gosh, like I could have done research with that, or I should have taken before and after pictures of the numbers, or I had my phone on me, I could have videotaped it. Like, but for me, it was like, well, of course, he was just subluxated. And because I downplayed it though, it's like I felt like I could have helped more people. Does that make sense? And I feel like it's kind of the same. It was like I don't know. I just maybe I should be more excited about it. And I should have oh my God, look what happened to people. And you scream it from the rooftop. But for me, it was so normal. It was like, of course he didn't go to the ICU, and I wasn't raised a chiro kid. My parents were not chiropractors. Mm-hmm. However, when I became a student, I just got so immersed in it because it was just like, this just makes sense to me. Mm-hmm. So that's really wild. And again, so there is kind of it's not a downside, but there's another perception of being raised in a chiropractic family and all the things we take for granted.
And I'll tell you this. I mean, I was telling you before we started the recording that I pay for my chiropractic adjustments. If there's not an exchange there, I pay for it. I have two brothers, one who's planning on going to chiropractic school. Maybe the other one will. I don't know. Yeah. Hopefully too. And
I see that in my brain, by the way, already. So
I'm hoping it happens. But I mean, they don't go to chiropractors right now. Mm-hmm. And it just drives me nuts. And they say, well, why would we pay for it? We've had it all our lives. We'll just wait till dad comes to visit or you come and visit.
Right.
And I'm thinking, you're going to be chiropractors. Don't you want people to pay for your adjustments at some point? Don't you need to understand the value of it? And so from me, keeping myself in check is paying for it. And I've sent Steve to other chiropractors. He's been my husband he's been on care plans. I will do that for Margot if it's needed, not to say that I'm not great, but I don't want to miss anything. And I want just different input into their system to make sure they're expressing health to their fullest. And I have no problems with exchange and value. Because I'm asking patients to pay me for that same thing.
Right. And what we did with our kids when they got a little bit older, maybe in middle school, maybe a little bit before middle school, and they would come to me at night and say, Mom, will you check me? Mm-hmm. We started doing this thing, and it was really Ron's idea. He said, no, everyone, you want to get checked, come to the office. So we started, we'd only check them in the office unless it was like a sports injury or something happened, on a Friday night at a basketball game. The reason why we had them go to the office and get checked, because once they were into college, we wanted them to be used to going to an office and getting checked.
Yes.
We made them sign in, we made them wait, and we made them, go back in the room, get adjusted, and walk back up to the front. I don't know if they scheduled their own appointments afterwards, but it was we just didn't want to spoil them, so to speak, so that when they weren't living with us anymore, that they would just feel like, well, I'm not going to go to another office and get checked. Again, I'll just wait for my parents to come in town, or, and when they went to undergrad, we found them chiropractors, and they went and got checked. So,
because you want it to be their decision, not yours.
Yeah.
I mean, I can remember I didn't have that. Again, I went to undergrad, so close to my parents that my dad continued to adjust me. But I remember going to my first chiropractor, first initial exam, and I thought, this is weird. My dad's not adjusting me, and I love how you created a framework for your daughters to get used to going into an office, to experience that as, as a patient or a practice member, whatever wording you want to use.
Yeah. And they also would call and they'd say, well, that was weird. This was weird. Anything that was out of the ordinary was they adjusted me facing up. They adjusted me in the chair. There was and we kept saying, that's great. That's great. Sometimes we had to pivot. There was times where we're like, that sounds like that chiropractor's probably not the best fit for you. Yeah. Let's find you somebody different. So we had to do that. But if it was just little things, that's great. Wow. How great and cool that you get to be in a different office. So as we start to wrap up, there's two questions that I want to ask you. The first one is, what advice would you give to yourself if you could go back and talk to Miaken as a chiropractic student?
Yeah, again, I guess I go back to growing up in a chiropractic family because I lived it. I didn't necessarily know the educated portion of, and I even hate to say the educated philosophy, because we talk about innate, but I guess I would have plugged myself into, philosophy club or something early on, just to understand innately what I was already doing.
Yes.
Because I don't know if it was because of school I went to, but it was a hard gap to bridge when I was out in practice, the pain-based care and the life care. Even though I lived the life care, it was an easy piece to just say, oh yeah, and of course you're going to be getting adjusted for the rest of your life. We're not going to start there, but we're going to work our way there. You know what I mean? So it was getting that piece, because living it is different than selling it,
Yes.
and educating that.
Yeah, that's great. And then I don't know if your advice would be different for Miaken as a new doc, a year or two out, 3 years out. If you could go back and speak to her, what would you tell her?
I would say, I'm telling you, every year is still hard. I think, oh yeah, if I just make it to the 1 year mark, if I make it to the 5 year mark, I still say, okay, if I can make another year, I'll be happy. I would just tell her, keep your head up, keep doing what you're doing, keep saying the things, and you will attract your people and you will build a great practice. And, there is growth potential still now, but there you will grow. Just be who you are and keep working at it.
That's great. And that's
bring your friends along, just connect with your chiropractors who are doing the same things, because you're all working to create a change in your world, And
that, to me, that's a common thread I hear a lot. Get a coach or find your tribe. And I know, because Lauren lives here in Denver, I know there's a great group of chiropractors here in Denver, and I know that keeps you grounded. So that's great advice for anybody who gets out or is just starting out, is find those connections. So,
I think I do have a coach, and I think I don't even mention them because they have been such an integral part of me in my practice. And so I'm like, oh yeah, I assume everyone is working with somebody to help support them, so yeah, absolutely.
Well, thank you. Thank you for your insight. I think, you had great little nuggets there. I think that the maternity question comes up a lot for women, especially now, because I think it's 50-50 as far as men and women in chiropractic schools. Sometimes it's a little bit higher. So that's not an issue, but that's going to come up a lot.
Yeah.
Nice to
hear. If anyone wants to reach out and ask questions, they're more than welcome.
Perfect. Because
I'm realizing I even created training. I scheduled like a whole training around my CA working with the docs to train on procedural stuff in my practice.
Perfect.
Yeah. So anyway, side note,
great.
Sorry about that.
Well, that's okay, because your information is listed below. So if anyone wants to reach out and get in touch with you and connect, I hope that's okay with you. So,
of course.
Okay.
Of course.
And to our audience, so thank you for being on. Thank you for joining us today. Thank you for being part of Life West's mission of creating a brighter future for humanity. We hope you enjoyed today, and we'll see you next week's episode of Life by Life West. Stay healthy, be happy, remember to get checked, and have a great day. Bye.